Hi guys, welcome back to G Chats with your host G. We are joined as always in the G spot and I'm super excited for today's episode. I know I might seem a little low energy. I'm under the covers. I'm not feeling too well. I'm on my menses today. It's day one, so I'm not feeling the greatest, but it happens to all of us. The show must go on, and so I'm just trying to push through. I'm feeling okay right now. I definitely wanted to film while the cramps kind of subsided so that I'm not like cramping during this episode. But I'm super excited for today's episode because it is going to be about Black women and how they deserve better, specifically exposing the health disparities that impact Black women. And this was actually our Juneteenth topic, but I had been traveling and doing things for work, so things kind of got messy on my calendar that I made a mistake in when I was like arranging it. I was arranging things on July, but it was really June. So I messed up. So I definitely want to get this video out there and I want to film it and talk about it. This is something that I am personally extremely passionate about. Not only do I have family that I absolutely adore that are Black women, and best friends and loved ones, but regardless of, being associated so closely with Black women, I am such a strong proponent of equity for literally everybody, especially when it comes to women's healthcare. I think that all women deserve access, deserve the freedom of choices, deserve all of those things. It doesn't matter what you look like, who you are. I believe everybody globally deserves this. It's a mission of not just my brand at With Meraki Co., but it is a personal passion of mine to make education accessible, make products accessible, do all of these things. And that's kind of why I even started like the podcast, because we obviously know that TikTok's not a forever platform, and I want to diversify my platform to give out free education in some degree or to some capacity of something that I'm super passionate about, which is female reproductive health. So I am really excited for this video and just to have you guys learn something new and talk about the disparity when in healthcare for Black women, because it's very important and it's often ignored, and it's something that I just think that anybody in the healthcare industry needs to be speaking up about, because Black women do face this every single day. And as someone who works in the reproductive health space, who believes that equity is not optional, it's urgent, I wanted to break this down and break it down clearly, factually, and unapologetically. So if you are a Black woman who is listening to this one is for you. And if you are not a Black woman, this video is still for you. We all should be listening and learning, because that is what matters to unite us all. So without further ado, let's get into some statistics, because the stats don't lie and numbers are important because they do speak volumes. So according to the CDC, Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women in the United States. And this was per the CDC in 2020. And that's not because of biology, it is because of racism. Black women also face the highest rates of hypertension and cardiovascular complications among all women in the United States, according to the American Heart Association in 2018. And they're more likely to experience severe fibroids, endometriosis, and PCOS. All these conditions are often diagnosed late or dismissed entirely. And there is a study that really did shake me. In 2016, there was a paper that was published in the Proceedings of the National Academy of Sciences, and researchers found that half of medical trainees believed that Black people have thicker skin or feel less pain than white people. And again, this is something that's not just ignorance, it's baked in bias that costs lives, Black lives. And if you guys did not listen to my previous videos, I talked about like the history of female reproductive health in the United States. It was one of my very early episodes, and oh my God, that video irked me because we touched on some of this, and this is more like now we're honing in, if you will. But this is just something that is even still taught. The fact that this is for medical trainees. Like, so this is people that we are training to be in the medical field, and this is the training that they're receiving. That is damaging. We have people who are going to become medical providers, and that is their view of Black people. That is damaging because it does cost lives, Black lives, and that is important to point out. And so you might be thinking, why is this the case? Why do people believe this? What is behind these disparities? And it is not an individual failure. It is a systemic failure, and we have to talk about the root causes. So first off is none other than medical racism. This isn't just a buzzword. I know sometimes it floats on the internet, and a lot of people like to take like certain words floated around, don't understand the meaning of it, but this is real. It shows up when doctors don't listen, when pain is dismissed, and when symptoms are minimized. And then there's the legacy. So the problem is it's built on medical racism, right? And restricting Black women for a multitude of different ways, whether it's access to products, whether it's believing them when they say that they're in pain. Regardless of the exact scenario, medical racism is the root of why this exists. And then to add on that is the legacy. And when I say the legacy, the issue is that there are so many cases of the mistreatment of Black women throughout reproductive history in the United States that unfortunately it set this tone in our country that this is okay, this is acceptable, this is applicable, and it does apply. So there's the legacy of Henrietta Lacks. And if you guys did not watch that video that I have, you definitely should. I talked about the HeLa cells situation, which involved Henrietta Lacks, a Black woman who had cervical cancer. So if you did not watch that episode, I 100% recommend you watching it because that is an ethical issue. I learned about that in bioethics. I also learned about it in AP biology in high school. So I've known about Henrietta Lacks' story for pretty much my entire adulthood. I was like 17 when I learned it. So my entire adulthood, I knew about Henrietta Lacks, and I actually was the lead lawyer when we did it in AP biology who was defending her and her family. And so it was like an activity that we did in class, and I wrote a paper on it and stuff like that. But medical ethics is something that honestly was an afterthought, especially when it came to Black women. Ethics did not apply to Black women. And so they suffered at the hands of these physicians and medical professionals because ethics just simply did not apply to Black women. And it's a really disheartening thing to see. So we have the legacy of Henrietta Lacks, whose cells were taken from her without her consent, and they were used for research for decades. And then we have the legacy of this like asswipe, James Marion Sims, which again, I talked about this in one of my earlier podcasts about the history of gynecology in the United States, where we talk about him. And he's the so-called father of gynecology, and he literally tested on enslaved Black women without anesthesia. And I'm not talking like, oh, just like little tests, like no, was like horrifically testing on Black women. And their names were Lucy, Betsy, and Anarcha. So I always bring them up because we have to say their name to remember the history. And so that ultimately bleeds into situations that we see today, such as the fact that there's a lack of representation in medical trials. We know in general women were not allowed to be a part of clinical trials for years and years and years, and now women are. However, in 2022, in a 2022 review, less than 5% of participants in reproductive health studies were Black women, and that means that treatments might not even work on them the same or as well on our Black patients. And this is something that's super important because when we look at something as little as, and I'm referring to it as little, but I mean like as niche, if you will, as the vaginal microbiome. One of the biggest things that I discovered in my research when I started studying the vaginal microbiome is the fact that different racial groups and different ethnic groups have different compositions of the vaginal microbiome. So there isn't, and that's why I always say there isn't this like one size fits all lactobacillus strain that is like every single person needs to have, because diversity is important. Ironically, with our own bodies, our microbiomes are all so different. What is bad in one person might just be fine in another, and what's good in one person might not be present in another person. And it doesn't mean that their vaginal microbiome is not good. It just means that they have a different good strain. And so that's why, like, when I was formulating and coming up with this criteria of what I want in my future product and in my future brand, I wanted lactobacillus diversity. That's what was like the core, because I recognized very early on that it isn't just this like one strain that I need to push and I need to promote, because in my research, I recognized that different ethnic groups and racial groups have different microbiome compositions. And that's important to make a product that can fit everybody and support everybody in that way. And that is true for every part of our body, not just the vaginal microbiome. I mean, something as small as like lactose intolerance, we know is like gene dependent, and it matters where you come from on the globe, and everybody's genetics work differently. And the same is for the vaginal microbiome, and the same is for literally every other part of our body. So the fact that Black women and just there is not diversity in clinical trials is dangerous, because even if women are allowed in research now and in clinical trials, a Black woman's body may very well differ from a white woman's body. And so sometimes it gives off that adding women into clinical trials is something that is done just for optics and just for show. And it's not really because they care about the medication's effects on a woman. Because if they did, they would want to care about how it affects all women, not just one group and one kind of woman. So that to me, that's just very telling. And this is as recent as 2022. So that's only 3 years ago that this said less than 5% of Black women are involved in clinical trials. So how do we know how medication is impacting their bodies? How do we know? We don't. And that is so sad. And that puts women at a greater risk of medical mistreatment, medical failures, medical negligence. It's really, really disheartening. And this bleeds into, unfortunately, and something that we can't forget is the socioeconomic barriers, because inadequate insurance, lack of nearby care, unpaid leave, and honestly, just the sheer cost of getting a second opinion is yet another barrier that we do see. And we do know that systemic racism and redlining, if you guys don't know about redlining, you don't know about systemic racism, especially when it comes to the economy, I really, really urge you to educate yourself on all of these things, because there is a reason why there are socioeconomic struggles for Black people. It's not this narrative that people like to create, that if somebody is low income, they're there because they made the choice. And they're like, I understand that choices are very important to navigating your life, but there are things that unfortunately Black people are set up in socioeconomic ways for them to actually struggle. There are barriers that are present, and we have to acknowledge them. And those barriers do exist, such as just access to care. So I think it's just very important that we keep that in mind, because we know that the medical system is directly causing a lot of these issues within medicine. But I also just felt like I couldn't touch on that without bringing up the socioeconomic barriers as well, because they do affect Black people and Black women. And it's important to mention it and not just like glaze over it and ignore it, because there is a difficulty with trying to get access to care, with trying to get a second opinion, just like the cost of it. And that is just in general, right? Like this can affect anyone. And it's the way, unfortunately, even the medical system is set up. But this just creates a deep generational distrust in the healthcare system. And honestly, it is rightfully so. So I wanted to touch on reproductive health and like really break it down. I want to zoom in on reproductive health because this is where a lot of my own work lives. So we should start with something like fibroids, because I feel like a lot of people know the word fibroids and know what fibroids are. Over 80% of Black women will develop fibroids by age 50, compared to just 70% of white women. And the symptoms tend to be more severe, earlier, and more likely to result in surgery or hysterectomy. Endometriosis is a long thought to be a white woman's disease, but really it is underdiagnosed in Black women despite similar or even more severe symptoms. And then there's bacterial vaginosis and chronic vaginal infections. This is my area of expertise, and studies have shown that Black women are more likely to experience recurrent BV, and yet providers often blame hygiene rather than addressing microbiome imbalances, hormones, or even potential partner transmission. And it's something that I see very, very often. And unfortunately, we do have to consider that when these things affect Black women, something like bacterial vaginosis and vaginal infections, when they are affecting Black women more than they're affecting white women, it pushes this the social influence and stigma that Black women are dirty, Black women don't know how to take care of themselves, Black women are not clean. But some of the cleanest people I've ever met are Black women, and it's not about hygiene, but unfortunately it reinforces the stigma that Black women are dirty, they're not clean. And so it's not even about that. And I always say, it doesn't matter who you are. If you're having bacterial vaginosis, it doesn't mean that you have poor hygiene. It is an internal microbial imbalance. Your ecosystem in your vagina is thrown off. It's out of whack. We can fix it. You can fix it. It's possible to fix it. It is the way that it is cared for and treated and talked about in the medical system and like socially within our society. The way our society views vaginal infections and the way that our medical system treats infections go hand in hand and impact Black women specifically, because they are made out to be dirty and gross. And that's not the case. So it's something that we see over and over and over again. And I honestly, don't even get me started on pregnancy and childbirth. A 2019 New York Times report found that Black women with advanced degrees still faced higher maternal mortality rates than white women without a high school diploma. So education doesn't protect you from racism. And this is very important. And the reason I included it is because I always see people trying to blame Black people for their socioeconomic or just economic status, if they're low income or something like that, and say, oh, well, you don't have access to a good provider because you are low income. So make better decisions so that you have access to better providers. But there is a study that shows us that Black women with higher education, they hold degrees in higher education, and they are pregnant, they are still having and receiving worse care and more likely to die during childbirth than a white woman who does not even have a high school diploma. So we're talking education doesn't matter. Economic status now does not matter. Black women are facing this disparity because of their skin color. That is racism, and it's racism that you and I and nobody else should ever be ignoring. So this is the cornerstone of why this episode was so important for me to do, because I am so passionate about breaking down this information that goes around that it's just, well, if you're low income, that's what you should expect. No, because there are women who are not, Black women who are not low income, and they are still facing it. And realistically, the fact that they are facing higher maternal mortality rates is scary, because that's just medical death, like the ability to die under the care of your physician during child labor. Imagine every other reproductive health concern that does exist. Not even, honestly, let's shoot out of reproductive health, but even just thinking of anything that happens in their body. If somebody has cardiovascular disease, if they're having a cancer, or they're having anything. I mean, the list could go on, and I feel like I'm like stuttering on my words. But the point is if women, Black women, are at a greater risk of maternal mortality, so dying during child labor, than white women, regardless of their education, regardless of their economic status, and that's just maternal mortality rate. Like, let's just think about how much this is impacting them on every other part of their health, not even just reproductive health, especially reproductive health, but literally every other body system that they might be seeing a specialist for, their physician for. It's ridiculous. And there is an emotional and cultural toll that it's just another layer that's harder to measure, but it's just as real. And it is that emotional and cultural toll. There's this unspoken pressure to be the strongest Black woman because of this that does exist, because of the disparities that do exist. So it is this narrative to endure pain quietly and not complain, to hold it all together. But that strength narrative, it can be deadly when it prevents people from being heard, from being believed, and from seeking help. And I actually thought of this when I was watching Love Island, which everybody's been watching Love Island, but my heart broke during Casa when Alondria had to leave. And she was in the dressing room and like packing her bags and stuff like that. And when they all told her, like, you're so strong. And I knew immediately when she wasn't crying, I knew that she had this like wall up, because I know as a Black woman that she felt she has to be strong. And I literally, like, I called it seconds before she said it. And the reaction of the castmates, I know they meant well, but when they were saying like, you're so strong, you're not even crying, I was like, oh, guys, she's not crying because of this pressure that I know she's feeling. I can see it in her eyes. She's feeling this pressure because she feels that she has to be this strong Black woman, and it's something that society has, whether it's intentional or unintentional, has placed on her. She literally, the next sentence said, I had to be strong my whole life, and then choked on her words. That got me. Like, I started crying. Like, my heart broke for her. And it's something that we know takes a toll. It is an emotional burden that Black women have to face, because they are cut out to be people who don't feel pain, and they have to live up to that. And it's just not realistic. And this leads to something that we know is prevalent in Black culture, and it's generational silence. So much of our reproductive health education comes from whispers or warnings, and not really empowerment, right? Like, just to keep things on the low, don't say anything. And this is a core value of my brand, and why it's not just about the products for me. Anytime somebody, if I ever see a comment, someone's like, oh, well, like, you sell your probiotics. I'm like, you can buy my probiotics, and if you do, I love you. Thank you very much. But what is more important to me is that you walk away educated. I want to be able to give you access to real scientific information, because that is what matters, so that you can learn the information, you can learn the science, and then you can advocate for yourself in the doctor's office. But I also like to create a space where you feel safe enough to do so, right? Because I can give you all the education, but we know that these conversations are taboo. There's a lot of stigma. And so my job is to break that stigma, break that taboo, so that what you can do is go into the doctor's office equipped with science and information, but then also feel like, oh, I don't need to be scared. And I know when my doctor is BSing me because I learned this information. I know when they're BSing me, I'm going to stand up for myself and I know how to advocate for myself. That is the goal here. But unfortunately, we have generational silence, and it's something that I've experienced in a ethnic home where it was like, oh my God, you have a UTI, don't say anything. Oh my God, you have this, like, don't, like, it's everything's like hush hush, low key. And it doesn't need to be this way. It's okay to have a UTI, bacterial vaginosis, PCOS, a cyst on your ovary, a hysterectomy, whatever, like there's different situations that exist with reproductive health, and suppressing people from talking about them and feeling ashamed of them does not help anyone. It doesn't better the situation ever. And so I think ultimately the end result of this emotional and cultural toll is that every time a doctor shrugs off your pain, every time a friend says it's probably just stress, you are left doing the emotional labor of proving that you deserve care. And that's not right. Nobody should have to do that. That is not right. So stories do matter. And I do encourage, if you are a Black woman watching this, reach out to my website in our contact us form. Share your stories in the comments. And I will always advocate for better care for Black women because their stories do matter. And I'll share a story that I'll never forget. One of our community members, and I'm going to call her for the sake of keeping this anonymous, her name is Brianna. She shared how she went to the ER 5 times in 1 month for intense pelvic pain, and each time she was sent home with ibuprofen. It wasn't until she collapsed that she was admitted. And then they discovered that severe endometriosis and a ruptured ovarian cyst is what was causing the issue. Another woman told me that she was repeatedly told that her recurrent BV must be due to poor hygiene, only to later discover it was tied to a hormonal imbalance and microbial dysbiosis that no one ever tested for. And these stories are not isolated stories. This is the system. And so if you have more stories of your own, reach out to me on our contact us form. I love hearing your stories. I never obviously I want you guys to always share this in confidence, privately. None of it will ever get told with your names or anything like that. But I do respond to a lot of the inquiries that I do get with stories, even if it's not to purchase a product or not to get advice, and you just simply what you're looking for is to just share your story and have that conversation. I make sure to give you a safe space to do that with me. And so these stories, again, they're not isolated stories. It is the system, and we have to talk about what needs to change. So what do we do about this, right? This whole episode now, it's been 20, 30 minutes into us talking. What do we do about this? Number one is we need more Black providers. We need more Black providers, Black doulas, researchers. Representation matters. We need more representation in all fields of reproductive care, not just in care, just in medicine, but in the shaping of the science itself, which is why I included researchers. We need more Black scientists. We need more Black doulas. We need more Black people in care across the board, because even if we are putting Black people in positions within the medical system, such as doctors and physicians, the science still needs to change, because there's a lot of medical misogyny and medical racism that does exist in the science that then still trickles into the way Black physicians are treating their patients. So it has to start with the science, and we need more Black people and more representation in research. We have to start at the root, in research, in the science, in the care, the doulas, the physicians across the board. We also need to train existing healthcare professionals in anti-racism and trauma-informed care. One-time DEI training will not cut it. It just won't cut it. It just won't. And I say this because we don't need professionals, medical professionals who are just not racist themselves. We need medical professionals who are anti-racist. Okay, there is a difference between just you not being racist and you being anti-racism. Anti-racism is you actively fighting against racism in your career. You have to be a part of that when you are a professional who is giving care to people, and your responsibility and your job is to care for people. You need to be anti-racism. You can't just say, well, I'm not a racist, and it stops there. You have to actively fight against racism. Racism is alive, and it is flourishing, unfortunately, and it probably will for the next 4 years. So you cannot just say, if you are a medical professional, I'm not racist, and throw your hands up. It's not even about not being racist. It's about you stepping in and being anti-racism. Like, you got to fight against it, especially when your job is to care for people. And so, unfortunately, we see different professions and different companies. They will do like one-time DEI trainings. That's not enough. That is not enough. We have to have a whole educational criteria about what racism exists in the medical field and how to combat it, be anti-racism. And trauma-informed care is also really important because, unfortunately, because of the racism that does exist in the medical field, there will be Black people who experience trauma from their care. And so you have to approach caring for them far more gently. I mean, you always need to approach with gentle care, but even more gentle when it comes to caring for somebody who has that trauma in the medical space and within medical care because they've been neglected or they've been misunderstood, underdiagnosed. Like, there's a lot of like fear that does exist, and you have to approach that with in a very detailed and like strategic way. And that's something that like has to be trained and it has to be taught. And we also need to fund and center Black-led public health initiatives. Groups like Black Mamas Matter Alliance, Sister Song, and the AFIA Center are all doing vital work, and we need to center them. It's important. They need to be present. They need to be known. If you guys don't know who they are, I will leave their links down below so that you guys can go check them out. And we also need better access to culturally competent care, which does include fertility support, pelvic floor therapy, and microbiome testing, because we need to approach reproductive health as a comprehensive way and not just an afterthought. Vaginal health is still an afterthought. We don't want that anymore. We do not want that anymore in our society. We need to view reproductive health as comprehensive. And more importantly, we need to empower education, because when Black women know their bodies, they know their rights, and they know their risks, they can advocate more effectively, even if systems are designed to silence them. So if you are a Black woman who is listening, your pain is real. Your health does matter. You are not being dramatic. You deserve more than just survival. You deserve optimal, joyful health. And if you're not a Black woman, start asking questions. Start asking questions. Use your voice to challenge broken systems. As I said, you can't just be not racist. You have to be anti-racism. You have to fight against racism. I'll leave you with this. Dismantling a racist healthcare system isn't charity. It is justice. And you can check out our show notes down below for the studies that I talked about, organizations, and actions for the next steps. And as always, I want you guys to make sure that you share this with someone who needs to hear it, whether that's a friend who you bond with over this, where you're like, we need to throw the system away and rebuild it and fix it. You have a friend that you're passionate about this with, somebody that you love is a Black woman who you feel needs to hear this. Regardless of what that is, I want you guys to share this, like this video, comment, let's engage. But I do love you guys so much. I will leave all the details, as I already said, of the research, the organizations I discussed, all of that in the show notes. But I felt that this was a very, very, very important topic to bring up and to discuss. I loved putting it together because, again, I'm very passionate about this. So I love you guys so much. Thank you so much for tuning in into today's episode. Let me know what you guys want to see next, and I will see you guys next week. Bye, guys.